Hi friends, today's our topic is windows or vacuum delivery. You might have watched my last video, it was forceps delivery. This forceps delivery and vacuum delivery comes under instrumental vaginal delivery. So without wasting time, we can move on to our today's topic, windows or vacuum delivery. Vacuum delivery is an instrumental vaginal delivery in which we are using a vacuum cup which is applied over the fetal scalp in order to create a vacuum or negative pressure between the vacuum cup and fetal scalp. After that, we are applying a controlled traction in order to deliver the fetal head during second stage of labor. Before moving to the topic, it is very important to understand the parts of vacuum machine. Vacuum machine has different size of vacuum cup. Usually it ranges from 30 millimeter to 60 millimeter. Then we have a vacuum generator and vacuum traction tubings. Next, we'll see the different types of vacuum cup. We have milestone cup, bird cup, kiwi cup and soft cup. First, we'll see the milestone cup. It is a metal cup. Its center attached a metal chain passed through the rubber tube. The other end of the chain is attached to the handle for traction. Next is bird cup. The suction rubber tube is attached to the periphery of the cup while the handle of traction is attached by a separate short metal chain to the center of the cup. Next is the soft cup. It is a bell-shaped 6.5 cm diameter soft cup which is made of a firm but supple ciliastic material. Soft cup has its own advantages and disadvantages. First, we will see the advantage. It produces symmetric, less cosmetically alarming caput, succedaneum and less scalp abrasions. In case of disadvantage, it slips more than the metal cup but with less scalp injury. The last one is kiwi cup. It is a handle-held disposable vacuum device used to assist vaginal delivery during second stage of labor. The kiwi cup is a soft plastic or silicone suction cup which is attached to a manual vacuum pump applied to the fetal head to help guide the baby out during contraction and maternal pushing. Next, we'll move on to the indications of vacuum delivery. These are maternal distress in second stage of labor, fetal distress in second stage of labor, prolonged second stage, to shorten the second stage, for prophylactic use in mothers with cardiovascular, respiratory and cerebrovascular disease. Next will be the contraindications, which include fetal prematurity, non-vertex presentations, malpresentations, fetal scalp trauma, unengaged head, incomplete cervical dilatation, active bleeding or suspected fetal coagulation defect, suspected macrosomia and cephalopelvic disproportion. Before moving to the procedure by step, it is very important to understand the prerequisites of windows application. These are: bladder should be emptied before the procedure. Cervix should be fully dilated. Membrane should be ruptured completely. The presentation should be vertex and the station should not be above +2. There should not be any evidence of cephalopelvic disproportion. So these are the prerequisites of windows application. Next, we'll move on to the procedure. Here I will explain about the procedure of windows application. In that, first one is preliminaries. Pudendal block or perineal infiltration. That means the perineum should be infiltrated by pudendal block. Assemble the equipments. Then test the vacuum machine whether it is working properly. The procedure includes two steps. The first one is application of the cup. That means the proper application of the vacuum cup over the fetal scalp, and the second one is proper application of traction in order to deliver the fetal head. So first we will see the application of the cup. Retract the perineum with the two fingers of other hand. Then cup placed against fetal head near occiput. Knob of the cup should be pointed towards occiput. When it comes to the traction aspect, the traction must be at a right angle to the cup. Traction synchronized with the uterine contraction. Traction along the axis of the birth canal. Traction should not exceed 30 minutes and no more than 4 successive contraction. That means we are not supposed to give a traction more than 3 to 4 successive contraction. I think it is very difficult to understand with this explanation of procedure. So I'll be displaying the video related to the applications of windows. Please have a look on it. I think that will be very useful to understand the procedure very easily.
Step 1 is to locate the flexion point and calculate the cup insertion distance. It's important to know the length of one's middle finger. The average distance from the tip of the finger to the proximal interphalangeal joint is 5 to 6 centimeters, and that from the tip of the finger to the metacarpal phalangeal joint is between 10 to 11 centimeters. The flexion point is located during vaginal examination by identifying the posterior fontanelle and then moving the middle finger a distance of 3 centimeters along the sagittal suture towards the anterior fontanelle. The tip of the middle finger will then mark the location of the flexion point. With the knowledge of the length of one's finger, the clinician then calculates the distance from the flexion point to the perineum by noting where the posterior fourchette makes contact with the back of the examining fingers when the tip of the middle finger is at the flexion point. In this particular example, the distance measured to the flexion point is approximately 8 centimeters. This is called the insertion distance. Step 2 is to hold and insert the cup. The clinician holds the cup on its side, ensuring as low a profile as possible, with the thumb on the tube in the groove on the back side of the cup, and the index finger on the edge of the cup. 1 or 2 fingers on the other hand is used to retract the perineum if necessary, while the cup is placed gently against the fetal head. At that point, the fingers are removed from the vagina and the clinician lets go of the handle to allow the stem to rest on the perineum naturally. Step 3 is to maneuver the cup toward and over the flexion point. Note the Kiwi Omni cup contains marks at 6 and 11 centimeters to assist the user in accurate insertion distance to place the cup over the flexion point. Once the cup is placed against the fetal head, the clinician should note where the stem of the Kiwi Omni cup intersects the posterior fourchette. If the distance is not what was measured in step 1, then use both index fingers to push the cup posteriorly in the midline of the maternal pelvis until the mark of the stem is equal to the distance calculated in step 1, which was 8 centimeters in this particular example. The key during this step is to ensure that the cup is moved along the midline of the maternal pelvis and avoid the natural tendency to push the cup laterally. Step 4 is to create vacuum and exclude the maternal tissues. Initiate cup seal by increasing the vacuum using the palm pump. Check that no maternal tissue is trapped underneath the cup by gently sliding one's finger around the anterior and lateral portions of the cup. There is no need to check posteriorly, as maternal tissue will rarely be trapped there. Increase the vacuum to 600 millimeters of mercury, 0.8 bar, or 80 kilopascals. That is the top of the green zone. Step 5 is to direct traction along the axis of the pelvis using the finger and thumb technique to avoid cup detachments. Press the thumb of the non-pulling hand against the back side of the cup and place the index finger on the fetal scalp to prevent cup detachment and to monitor the descent of the fetal head. Apply traction in line with the axis of the maternal pelvis. The axis will change as the fetal head descends. In general, one should maintain a 90-degree angle between the cup and the stem of the vacuum when possible. Note, this may not be possible with the first traction effort in malpositioned babies. Ensure to time your traction with the maternal pushing efforts. The Kiwi Omni cup, pictured here, contains a traction force indicator, which is designed to measure the force exerted during traction. It provides immediate visual feedback to the clinician as to how hard one is pulling. It is especially valuable for training and documentation purposes. During tractions, gradually pull on the device to assist in the delivery of the fetus, but take care not to exceed the recommended force of 25 pounds or 12 kilograms. It is recommended if one reaches the force range indicated by red, greater than 20 pounds or 9 kilograms, proceed with caution. However, if one is not making progress, then an alternative method of delivery should be considered. Finally, while delivering the fetal head across the perineum, ensure the non-pulling hand remains on the backside of the cup and the fetal scalp to help prevent cup detachment. Ask an assistant to provide perineal support if desired. Once the fetal head is delivered, remove the cup from the scalp by depressing the vacuum release button found on the Keeley palm pump opposite the side of the vacuum gauge. Then finish delivering the fetus in the usual fashion.
I hope all of you understood about the procedure of Windows application with the help of video. So I think we can wind up our today's section. The complication and the comparison of Windows and forceps delivery will be displayed on the slide. Please have a look on it. So in the next class, we will meet with another episode of midwifery topic. Till that, take care. Bye bye.